Hello everyone, welcome to our channel Simple Nursing Notes. आमी प्रीवियस वीडियो रे ऑलरेडी 15 टी क्वेश्चन एमएसएन रो पढ़ी सारिचे एवं एही वीडियो टी रे 16 रु स्टार्ट करिनेबा. ओके, चलो हमरा क्लास स्टार्ट करिबा. नंबर 16, which is primarily a developmental task middle age, learning and acquiring new skills and information, rediscovering or developing satisfaction in one's relationship with a significant other, relying strongly upon spiritual beliefs, risk-taking and its perceived consequences. The answer is B. A developmental task of middle age is rediscovering or developing satisfaction in one's relationship with a significant other. But 17. The medical surgical nurse who is caring for a patient with a new diagnosis of cancer. Observe the patient becoming angry with the physician and nursing staff. The best approach to diffuse the emotionally charged discussion is to allow the patient and family member time to be alone, arrange time for the patient to speak with another patient with cancer, direct the discussion and validation of emotion without false reassurance, request a consultation from a social worker on the oncology unit. The answer is C. Direct the discussion and validation of emotion without false reassurance. I think ए सबु आपण माने बुझी पारुथिबे, सेति पई मु याको डिस्क्राइब न करी आगु को जाउछे. Number 18, it is hospital policy to assess and record a patient's pulse before administering digoxin by auditing the nursing records to determine the frequency of compliance with this policy. The Quality Assessment and Improvement Committee is conducting a process analysis, a quality analysis, a system analysis and outcome analysis. The answer is A. The Quality Assessment and Improvement Committee is conducting a process analysis. A lanoxin or digoxin ହେଉଛି cardiac glycoside tablet. ଏହି tablet ର specific effect myocardial tissue ଉପରେ ପଡ଼ିଥାଏ and it is used to treat heart failure. Number 19. The nursing diagnosis for a patient with a myocardial infarction is activity intolerance. The plan of care includes the patient outcome criterion of agreeing to discontinue smoking, ambulating 50 feet without experiencing dyspnea, experiencing no dyspnea on exertion, tolerating activity well. The answer is B. Ambulating 50 feet without experiencing dyspnea. Ambulation ର meaning ହେଉଛି କୌଣସି ଆସିଷ୍ଟାଣ୍ଟଙ୍କର ହେଲ୍ପ ବିନା ନିଜେ ଚାଲିବା. ଆଉ ଏହି ambulation 50 feet without experiencing dyspnea is the best plan of care in case of myocardial infarction. Number 20. A nursing department in an acute care setting decided to redesign its nursing practice based on a theoretical framework. The feedback from patient, families and staff reflects that caring is a key element which theorists best support this concept. Options are Erickson, Maslow, Rogers, Watson. The answer is D. Watson. The feedback from patient, family and staff reflects ए सबु caring रो key element बोली क्यों theorists support करंती एही concept को. The answer is D. Watson. Watson कर full name ହେଉଛି जीन वाटसन. ए हेउचंती अमेरिकन नर्स theorist and nurse professor. But 21, which statement by a patient demonstrates an accurate understanding about herbal supplements? Options are herbs may interact with prescribed medication but not other herbs. Most herb has been tested and found to be safe and therapeutic. The Food and Drug Administration regulates herbs and allows advertising. There is no standardization among the manufacturers of herbs in this country. The answer is D. Number 22. For a patient with Crohn's disease, the medical surgical nurse recommends a diet that is high in fiber and low in protein and calories, high in potassium, low in fiber and high in protein and calories, low in potassium. The answer is C, low in fiber and high in protein and calories. ଏହି କ୍ରନ୍ସ ଡିଜିଜ୍ କ'ଣ ଯେଉଁଥିରେ କି କିଛି ସ୍ପେସିଫିକ୍ ଡାଏଟ୍ ପ୍ଲାନ୍ କରାଯାଇଥାଏ। ଏହି କ୍ରନ୍ସ ଡିଜିଜ୍ ହେଉଛି ଗୋଟେ କ୍ରନିକ୍ ଇନଫ୍ଲାମେଟୋରୀ ଡିଜିଜ୍ ଇନ୍ ଦ ଇଣ୍ଟେଷ୍ଟାଇନ୍। ସ୍ପେସିଆଲି କଲେନ୍ ଆଉ ଇଲିୟମ୍ରେ ଅଲସର ବା ଫିଷ୍ଟୁଲା ହେବାଟାକୁ ହିଁ କ୍ରନ୍ସ ଡିଜିଜ୍ କୁହାଯାଏ। ଇଟ୍ ଇଜ୍ ଅଲସୋ କଲ୍ଡ ଆଜ୍ ଇଲାଇଟିସ୍। ଯେହେତୁ ଇଣ୍ଟେଷ୍ଟାଇନ୍ କଲେନ୍ ଆଉ ଇଲିୟମ୍ରେ ଫିଷ୍ଟୁଲା ବା ଅଲସର ହୋଇଥାଏ ସେଥିପାଇଁ फाइबर फूड को कमा जाए एवं प्रोटीन और कैलोरी फूड को हाई करा जाए। नंबर 23, when examining a patient who is paralyzed below the T4 level, the medical surgical nurse expects to find flaccidity of the upper extremities, asphyxia and spasticity of upper extremities, impaired diaphragmatic function requiring ventilated support, independent use of upper extremities and efficient cough. The answer is D, independent use of upper extremity and efficient cough. Number 24, after completing a thorough neurological and physical assessment of a patient who is admitted for a suspected stroke, the medical surgical nurse anticipates the next step in the immediate care of the patient to include administering tissue plasmogen activator, obtaining a computed tomography scan of the head without contrast, obtaining a neurosurgical consultation, preparing for a carotid Doppler ultrasonography. The answer is B, obtaining a computed tomography scan of the head without contrast. Number 25, the first step in applying the quality improvement process to an activity in a clinical setting is to assemble a team to review and revise the activity, collect data to measure the status of the activity, select an activity for improvement, set a measurable standard for the activity. The answer is C, select an activity for improvement. Number 26, if glaucoma is left untreated, it leads to conjunctivitis, trachoma, retrolental fibroplasias, blindness. The answer is D. If glaucoma is left untreated, it leads to blindness. 27. Most common site of carcinoma in pancreas, head, body, tail, known. The answer is D. None of above. এই তিনোটি যাଙ୍କ অপশন মধ্যରୁ কোনসিটি भी कॉमन साइट नुहे। आंसर इज line of duct is the most common site of carcinoma in pancreas. ଏହି lining of duct को ductal carcinoma ମଧ୍ୟ କହନ୍ତି। Number 28, which cardiac marker raised first in myocardial infarction? CK, MB, SCOT, myoglobin, troponin. The answer is C, myoglobin. ଏହି myoglobin କ'ଣ? It is a red protein which carries and stores oxygen in muscle cell. Basically skeletal muscle और heart muscle रे ही ये myoglobin oxygen store करके रखी थाए। Number 29, respiratory center are stimulated by oxygen, lactic acid, carbon dioxide, calcium. The answer is C, carbon dioxide. A respiratory center brain रे ही थाए and which is the respiratory control center? Medulla oblongata is the respiratory control center. Number 30, most common cause of a chronic asthma: atelectasis, pulmonary fibrosis, pneumonia, emphysema. The answer is D, emphysema. Number 31, main clinical symptom of hiatal hernia by stomach hernia is vomiting, diarrhea, heartburn, lower abdomen pain. The answer is C, heartburn. Number 22, first most common type of cancer in female in India: cervical cancer, breast cancer, vaginal cancer, ovarian cancer. The answer is B. Breast cancer is the first more common type of cancer in female in India. Then Cervical cancer is second most common type of cancer in female in India. Number 33, most important aspect of management of burn injury in first 24 hours is dressing, antibiotic therapy, fluid resuscitation, plastic surgery. The answer is C, fluid resuscitation. Then 34, most important complication of peritoneal dialysis, DVT, diarrhea, peritonitis, hypertension. The answer is C, peritonitis. What is peritonitis? Peritonitis is infection in the abdominal lining. Number 35. Bell's palsy is associated with the lesion in of 11th cranial nerve, 9th cranial nerve, 7th cranial nerve, 3rd cranial nerve. The answer is C, 7th cranial nerve. ଏହି Bell's palsy ର meaning ହେଉଛି facial paralysis. Number 36. Earliest and commonest clinical feature of primary biliary cirrhosis is pain, pruritus, fever, jaundice. The answer is D, jaundice. ଏହି biliary cirrhosis କାହାକୁ କୁହାଯାଏ? Bile duct damage ହବାଟାକୁ ହିଁ biliary cirrhosis କୁହାଯାଏ. Number 37. Commonest cause of cerebral infarction, embolism, venous thrombus, aneurysm, arterial thrombus. The answer is A, embolism. Artery to artery embolism is the commonest cause of cerebral infarction. Number 38. Most common cause of primary hydrocephalus, overproduction of CSF, obstruction in CSF flow, slow reabsorption, none. The answer is B. Obstruction in CSF flow is the most common cause of primary hydrocephalus. Number 39. Most common type of renal stone is calcium stone, cystine stone, mixed stone, uric acid stone. The answer is A, calcium stone. ଏହି calcium stone को calcium oxalate stone ମଧ୍ୟ କୁହାଯାଏ. Number 40. Commonest site of peptic ulcer is esophagus, fundus part stomach, duodenum, antral part stomach. The answer is C, duodenum. Number 41. Rectal examination is done with a client in what position? Dorsal recumbent, Sims position, supine position, lithotomy position. The answer is A. Rectal examination is done with a client in dorsal recumbent position. Number 42. The heat regulating center is found in medulla oblongata, thalamus, hypothalamus, pons. The answer is C. The heat regulating center is found in the hypothalamus. Number 43. Most common type of skin cancer, malignant melanoma, squamous cell carcinoma, basal cells carcinoma, itching. The answer is C. Most common type of skin cancer is basal cell carcinoma. Number 44. Most common type of burn injury, chemical, thermal, electrical, inhalation. The answer is B. Most common type of burn injury is thermal burn.